passed a law through our Senedd, our national parliament, called the Wellbeing of Future Generations Act. It does a number of things, but the overarching principle is that it requires our government, our local government institutions, our health boards, our national agencies such as Public Health Wales, our Environment Agency, and so on, to demonstrate how, when they're taking decisions, they're meeting today's needs without compromising the ability of future generations to meet their own needs. The second thing that it does, and this came from a national conversation with the citizens of Wales, and there's something incredibly powerful posing a question, which is, what is the Wales, the Bahamas, the Egypt, the whatever country you want to leave behind to your children, your grandchildren, and future generations to come? What does that country look like? What does it feel like? How do we distill that into a set of long-term goals? And I always say you wouldn't think it was revolutionary for a country to have a set of long-term goals, but it is quite revolutionary, really, because endemic in our systems of governance, of politics, is short-term thinking. And this is where we get these really significant challenges that are never resolved, like the climate challenge, like the long-term challenges around health inequity, because we don't have that system of long-term thinking embedded and legally required in our systems of governance. So 7 long-term interconnected well-being goals with all of our institutions with duties to set objectives to maximise their contribution to all 7 of those well-being goals. And again, when we talk about futures, I often think there are a few different camps of people in this futures world. You often get the existential threat people, and there'll be a lot of people here because we are talking about existential threat. We often get people who are shifting beyond GDP, so the well-being economics, and then we often get countries who are very focused on delivering the SDGs. Now, what's again unique about the Welsh legislation is it brings all of those elements into one. Requirements to think and plan to the future, requirements to take action towards well-being, which is beyond GDP, and just to tell you, our definition of prosperity in our Future Generations Act is a productive, innovative, low-carbon society, one which uses resources efficiently and proportionately, one which acts on climate change, and one which develops a well-educated population with the skills to enable them to access decent work. Now, that's just one goal. It's about prosperity. Generally, if we talk about prosperity, we're talking about GDP. What we're saying in Wales is prosperity is about the well-being of our nation, not about economic growth. Economic growth may be a part of that, but that is not the end game in of itself. And then it's connected to the other 6 well-being goals. So for a healthier Wales, a resilient Wales, which is about maintaining and enhancing our ecosystems, about a Wales of cohesive communities, a more equal Wales, a Wales of vibrant culture and thriving Welsh language, and a globally responsible Wales. Now, how does that all connect back to what we're talking about here today, which is the nexus between climate and health? Well, again, for too long, not only have we not thought to the long term, but we've often thought in silos. So we're only really, on a global scale and going into the mainstream, starting to discuss this interconnection between human health and planetary health. If we'd been discussing it a long time ago, we would have recognised the effects of the degradation of soil is having on the quality of the food that we eat. We would have recognised the hundreds of thousands of people who are dying every year because of air pollution. We would have recognised the hundreds and thousands, an increasing number of people who are dying and losing livelihoods and so on because of the effects of climate change, flooding, extreme weather events and so on. And we would be recognising that that is only set to get worse, which is why it is important to recognise those challenges, but it's also important through those 7 interconnected wellbeing goals to look at where there are positive opportunities. Because again, often when we talk about futures, and it does feel a bit bleak arriving at COP here this week when we see only 24 of the 193 countries have come back with their extended commitments, where we seem to be talking about the same thing over and over again, but actually having that long-term vision that you can work towards and saying, actually achieving a healthier Wales or a healthier world is just as much about what we do in terms of the climate as what we might do in our public health system. Achieving the goal of a resilient world and the resilience of our ecosystem is just as much the responsibility in terms of what our economy department might do, how we plan our infrastructure, how we design our communities, how we build in biophilic communities and space for humans and nature to coexist. So this is where these things really do intersect. And what's really interesting, again, about our legislation is about that sort of placing that connection. So it establishes something called public services boards, which bring all of the key public services in each area together. And they have these collective duties to set a long-term well-being plan. And a few months ago, I was at one of these public service boards where the representative from Natural Resources Wales, which is our environment agency, was talking about the contribution that their organisation could make to tackling adverse childhood experiences. Now, when you get people in a space where you've got someone from the environment recognising that actually the environment has a key connection back to early childhood adversities, that's when you start getting an ecosystem of really exciting things to happen. I'm not going to hog the floor, but I just want to give a couple of other local examples around this and link that back to national examples. So the World Health Organization have done a really interesting piece of work, and Public Health Wales have been part of this, looking at what's the reasons for the difference in life expectancy. Particularly, this study was particularly in Europe. And what it showed is that 35% of the difference is about income security, so whether you live in poverty. 29% is about your living conditions, so the quality of your housing. So when we're talking about health in Wales, we're talking about the quality of housing. When we're talking about health, we're talking about the investment that our government is going to put in to build 20,000 low-carbon, affordable homes. When we're talking about health, we're talking about that 29% of the difference in life expectancy being about, are you living in areas of high air pollution? Which is why in Wales we are having significant modal shift, a new transport strategy which rolls out 20-mile-an-hour zones across the entire of Wales, a moratorium on all road building in Wales with 55 pre-approved road building schemes cancelled, and all of that investment that would have gone into building roads going into active travel, walking and cycling, because there you have the connection between addressing the climate emergency and improving the health of the nation. 19%, the World Health Organization tell us, of what makes a difference to life expectancy is about social interaction, the sense of community. Do you have a sense of agency? Can you affect your community and bring about change? Are you lonely or isolated, or can you rely on people in your hour of need? And so far from well-being being seen as the soft, fluffy stuff that government shouldn't get involved in, it is core to that metrics of 19% of what makes a difference between whether you die young or die later on in life, which is why that goal of cohesive communities is way beyond fluffy. It's really, really important. It's why we're making the connections between being a zero waste nation by 2050 to meet our climate targets, and thinking about how do we do that in a way which brings community together. So setting up repair shops. So instead of going and buying a new phone when it's broken, you can go to the community repair shop, you can interact with your community. If you're lonely and isolated, you might be able to have a chat with people there, and you can get your phone repaired, so it's part of that circular economy. Swap shops and libraries of things. Instead of keeping lots of things in our homes that perhaps we only use once a year, we are sharing as communities in Wales. That is reducing our emissions, that is reducing our waste, and that is bringing communities together. School uniforms, swap shops. Instead of having to go out and buy new, we are helping people who are living in poverty by saying we will organise swap shops for school uniforms, reducing waste from landfill and helping to address that goal of a more equal Wales. So I hope what I've given you today is a flavour of what is possible when you have a country which is saying, yes, we owe it to future generations to absolutely demonstrate in every decision that we take how we are acting in your interests and not disadvantaging you. And also, we will work collectively around those goals to deliver that future that we want to leave behind to our children, our grandchildren and great-grandchildren.
Thank you very much for this fantastic presentation, Sophie. And I think all of us who are here take close to heart this health-based view of approach to how we do not only climate policy, but any policy. Because as you have mentioned yourself, there are so many pillars of that policy that are being touched by it. And this is what makes it a both holistic, but at the same time very precise solution. Thank you very much again. And now moving across the Atlantic to you, Dr. Kelly. You, of course, oh, you can use this one. So you, of course, in the Bahamas were pioneering as well health-based approaches to well-being, to climate change, and in general to the policy. Based on your experience, what excites you about the initiatives like this one, and what would you think the Bahamas can also potentially benefit more from in terms of looking at the example of Wales?
Yes, thank you so much for the opportunity to be on this panel, and I congratulate Wales on their new act because it is really significant and synergizing the various areas that we really need to come together to improve the health and well-being of their country, but other countries. In the Bahamas itself, we just had a transition in which we are now named the Ministry of Health and Wellness. And so I think that is significant. Additionally, our Prime Minister, the Honorable Brave Davis, is really strengthening the area of climate change and health and has provided additional support. We just came out of a youth conference earlier last year, and our youth are here at COP27 as well. When we think of future generations and how to include them, we're starting to do that. What I like about this policy is where it is bringing together the various agencies. And in the Bahamas, we have the National Climate Change Committee that has the various agencies that sit on it. But in terms of having the policy that allows us to share the various information, but also to come up with innovative ideas, I think that is what I see this act being able to do. Additionally, I think the support of the government to make various decisions is going to be significant to our looking at our well-being and data in the Bahamas. And, you know, I would be interested in knowing, Ms. Howe, how you were able to identify the data space, because you need a baseline set of data to move from. And I think for our small population at 400,000, this kind of act can be pretty significant as we move towards adaptation and mitigation.
And you mentioned the population of Bahamas is 400,000. And at the same time, compared to its size, it's already being exposed to quite enormous health risks that are related to climate change. In the context of, you also mentioned the reorganization of the ministry and on the larger policy level, what are those levers that you are trying to pull in order to make sure that the health-based approach in the Bahamas is also responsive of those needs that arise with the health risks and climate change in Bahamas?
So you're very right. The Bahamas is among the top 10 countries in the world that are impacted by extreme weather events, and among the top 3, I think, in the region. And so because of that, the Bahamas had the opportunity through the EU CAREFORM project to get funding for its Health National Adaptation Plan. And so that's going to be significant for us in developing a plan that is community-based, as well as the Green Climate Readiness Proposal, of which we are in the midst of completing. A significant component of that is community engagement. We really need to hear from the community its needs. Dr. Hamilton and I, who are here, and our team, we were able to engage the 2 communities that were most impacted by Hurricane Dorian, Grand Bahama and Abaco. I want to say a shout out to them, that they were concerned about education, learning more about climate change, but also economic recovery. And so we believe that partnering with the community is going to be significant in our responsiveness to improve the health and well-being of the population, because really they know better about themselves, and really sharing with them about this Well-Being Act and how at a community level we can literally most likely have an opportunity to pilot the various agencies coming together, which they do currently generally for climate change or hurricane, but just thinking, what is the future? What kind of community we want to build, and how do we do that together? So I see that as an area of innovation that we can utilize.
This actually dovetails very neatly in many things that youth in climate space are also advocating for, because, for example, when it comes to finance, our call is always finance people first, projects later. Because this allows us to have less dry of projects, but actually see people's behind them. So I'm very glad that you mentioned that.
Thank you.
Now going to you, Tracy, and here I will probably ask you to put your head of the chief public health officer away for a second. But after hearing from Sophie about you were, of course, an integral part of the effort. But as a citizen, and what is the one thing that excites you the most out of the efforts that have already been completed on making sure that this strategy on future generations, on the health-based approach, actually takes off in Wales?
Thanks, Vlad. So if I answer the question, and then I'll put my hat on for a minute, if I can. So it radically changes the typical type of political decision-making. So Sophie was talking about preventing 55 new road infrastructure planning decisions. One of these is a major motorway throughput in South Wales. If anyone's ever been to Wales, beautiful country, you're very, very welcome. Now, the government having already spent a significant amount of money looking at extending lanes in this motorway, the decision was made not to proceed with it, because this is the air pollution associated with it, the well-being, the respiratory conditions, the increase in disproportionate impact, and I live near it, and it's quite a poor area where I live. It has a disproportionate impact on people who are already living in areas of deprivation. So that was a very, very brave decision to say, no, we're not going to do that. What we're going to do is actively look at alternative methods for public transport, for different modes of moving from A to B, a different place of work, rather than putting thousands more cars and buses on the road every day. So it is already changing decision-making quite significantly. And if I can just segue it into, with a bit of my hat for a moment, and take us up to kind of 30,000 feet just for a second, thinking about what we've all been through for the last number of years with the global pandemic, what many countries are currently going through as what we would call the cost of living crisis, and also climate change. There, in Public Health Wales, we did a health impact assessment looking at the compounding impacts of each of those public health threats on society. And it's the same types of individuals, it's the same types of population groups that are impacted more significantly every time we put another threat on top of them. What the Wellbeing of Future Generations Act does is, as Sophie says, it brings a framework for tackling those in a synchronized, holistic way, rather than having separate policies for this, separate policies for that. And that is about an all of government and all of, in Wales we are more prominent with public services rather than private sector, but an onus on all of public services to tackle this together. So, and maybe to give a couple of examples of it in action. Sophie was talking about people coming together, different organisations. We've established what we call Building a Healthier Wales collaboration. So this has our Natural Resources Wales Environment Agency, it has housing, has education, local government, sport, health. And we focus on, at the moment, 3 priorities. One is income optimisation, one is fair work, and the other is the first 1,000 days. And those are everyone considering their contribution for improving the well-being of future generations, but also tackling the challenges of today. The second example is just a personal example. Sophie mentioned this at a meeting earlier this morning. So we moved 550 staff into one new building. So we shut 17 offices down, and we wanted the building to be open plan, sustainable, and a place for collaboration. And we went through hell and high water to not follow the bureaucratic processes of procurement, because we said we don't want to do it that way. So, cut a long story short, 95% of everything in that working area is reconditioned, remanufactured, reproduced. We saved 800 double-decker buses worth of landfill, 132 tons of CO2, and as Sophie mentioned earlier, we commissioned social value companies who employed hard-to-employ people who then got jobs. So this was about, we were spending the money anyway. We chose to spend it differently on the basis of social return on investment and circular economy. And my final point, you mentioned finances. So if I had a top tip, it's not about spending more to do this, it's about using what we're currently spending better. And even if, and I know we've had many conversations about this, if a government chose to put a cap or a tariff to say we spend £8 billion worth of public money procuring every year, well, if we said, OK, for everything that was £1 million sterling and above, we want to see a 5% social return on investment, stimulate jobs locally, stimulate the economy, give people opportunities, then that really is about sustainable development, sustainable society, and technically, ultimately, we need health of society in order to sustain fiscally. So just to give you some examples.
That I think especially the last example you mentioned is very pertaining even to other aspects of climate policy. Like, for example, there is so much discussion about should we frame carbon tax as tax or a dividend? And I think this example, it is also a health equivalent of a dividend. So I'm glad that you mentioned it. And now that we are talking about future generations, Sophie, you were one of those people who were advocating for making sure that there is established a new UN Youth Office that will also cover the interests of future generations. And we will also see a future Summit of the Future coming in 2024. So in light of this, how are you looking forward to it, and what is the design that you see for it so that it would deliver the best for the future generations?
I guess my starting point is, and I'm sure many of the discussions that you've all been involved in during your time at COP and probably other COPs as well, have been about, how can we solve this particular element of the climate crisis? How can we secure this particular funding for adaptation, loss and repair, and so on? And all of those things are critically important. The problem is when everyone goes back to their home countries, most countries are still operating in systems of governance which are rotten at the core. And what I mean by that is they are systems of governance which do not look to the future. They're short-term. They actively discount the interests of future generations. So when you come back to our own countries and decisions are being taken within that context, we might have an initiative to solve this element of the climate crisis or fund this part, but still we're not actively in everything that we're doing, representing and considering the interests of future generations. So I think there's a few ways that we can do that. I mean, a law is one way of doing that. I should have said that I'm not part of the government. I'm an independent commissioner. It's quite a brave government who will say not only will we legislate to put these particular duties on ourselves, we'll also appoint someone independent who's going to tell us off if we don't and call us out and sometimes embarrass us and often give advice about things that they might that they should be doing instead. So I think that's that's one model. Obviously, it's critically important to be getting the voice of future generations into decision making, and I think we can hear the youth voice here at COP. I suppose there's a question to pose around, are those youth voices at the margins, or are those youth voices right at the core, built into decision-making and governance infrastructure? And I think some places do it better than others, but I think it's absolutely crucial that is within every governance infrastructure. I am a big fan of the UN Youth Envoy, Jayathma, who has done an amazing job of ensuring youth voice is absolutely central. But actually, even within the UN infrastructure, she's been struggling to do that. She's done amazingly well, but she's been struggling to do that because it's not resourced. And so I think that there's something about us recognising and valuing the contribution of young people. If we were to bring in consultants from a private sector organisation to tell us how we might solve this problem or that problem, we'd be paying those consultants a hefty fee, I imagine. If we bring young people in, that's not always the case. We don't always resource those interventions, and that was the case for the UN Special Envoy's office, or very, very tiny sort of infrastructure. So what she's been able to achieve now is funding for that office, which will strengthen it and put it on a really significant footing going forward. Furthermore, she's been really significant, and we've worked alongside her in making the case within the UN's own infrastructure that they should have to account for how they're considering the interests of future generations. So I'm really pleased and excited to see the Secretary-General's announcement in our Common Agenda document that he wants to have a declaration on future generations expected in 2024, the appointment of the UN Special Envoy for Future Generations, and reforms to the UN's own governance infrastructure, because the UN really must lead by example on that. And I think for the UN to show that this is absolutely critically important to achieving the SDGs, to addressing the climate emergency, to doing all of the things that we are saying must be done across the world, then they must put that governance infrastructure accounting for future generations in place within their own in their own house.
Thank you very much, Sophie, and especially the point of resource mobilization. I salute you for underlining it, because even if the UN Youth Office was UN Youth and Voice Office was struggling so much, I can also tell you that many young activists and advocates like me, not only all the labor that we are performing is voluntary, but oftentimes we have, for example, here to go to COP, we either have to pay out of our own pockets or heavily try to fund from whomever possible, basically. So this is a choke point that is indeed important to make sure that the office that is coming up will work for young people. And Dr. Kelly, Bahamas were also one of the countries who were highly supportive of the establishment of the office and the position of the envoy for future generations. How do you see, from the perspectives of the Bahamas and in general from Caribbean perspectives, the success of a Future Generations Summit of the Future in 2024, and how the UN and multilateral system can deliver for future generations?
Thank you so much for that question. I would say that for future generations and the success, I'm looking at one of those persons, in the person of Dr. William Hamilton. He is a up-and-coming youthful person, but also a physician who considered climate change as something significant and offered himself to be mentored, as well as to take the lead in addressing climate change and health in the youth population. We were part of the Youth COI in the Bahamas, and he was part of the organization and setting that up and engaging youth. And at the Ministry of Health, he conducted an orientation for the summer students in climate change and health, and brought together a lot of young people. Additionally, the government of the Bahamas has supported young people being here at COP27, and so they're funded, they're supported. So I think we're heading in the right direction. I think what is important is to have such an act that ensures that for future generations, they are continually at the center and not at the fringe. So I think that even though that they're here, I think they will need additional training and funding. And I think this experience will allow us to provide the recommendations, because we're on the adaptation team, and on a daily basis, we provide recommendations to the government. And I think this is a really significant area. If we're going to address adaptation and mitigation, then the future generation needs to be trained in this area. So I think that would be significant. I know the Bahamas is also able to develop its first country profile, which we brought here to share with you today. And I think that part was missing in it, the future generations and including that population. So we have some areas to improve as well.
That is definitely so. Thank you very much for your remarks. And we are glad to have been joined by Omnia as well. So, Omnia, before you joined us, we were primarily focusing on the need of such frameworks that are based on health and well-being, like in Wales, to tackle climate crisis, and the positive effects it brings. But at the same time, we think it's also important to properly introduce what risks we are facing if we are not following this path. So if you could, from your perspective, to introduce to the audience like a landscape of health risks that youth and children are particularly facing if we do not take into account health in designing climate frameworks.
So first of all, thank you so much for having me in this very important conversation. So just to give you a brief, I'm working with the presidency as the youth envoy, but I'm also a medical doctor. I'm doing my residency in plastic and reconstructive surgery. And from my experience at the hospital, I've seen on a daily basis patients presenting with heat stress because of the increasing temperature that we are seeing now in Egypt. I've also seen many exacerbations of asthma, especially in children, because of the high levels of air pollution. And how does this even relate to my field? I work in surgery, but because of their chest condition, they're unable to get the urgent surgery that they need. So you can see how the environment and our health is dependent on the environment, and it sustains us, not only when it comes to the disease burden that we see, such as the physical health impacts ranging from cardiovascular to respiratory diseases, but also our determinants of health. When we think about acute food and water insecurity, right now 1 in 5 children do not get access to the daily water needs that they seek. When we look at food insecurity, only in Africa, over 99 million are now suffering from acute hunger. And then when we also look, and most importantly and least prioritized, is the mental health impacts, especially on the children and the young people, because now they understand that climate change is impacting their future and the planet that sustains them, but at the same time they are not, but at the same time they are not at the decision-making spaces. They are just witnessing the very slow political will that is now driving towards climate change. We are still suffering from inadequate climate pledges. We do not see the translation of such commitments into solutions on the ground, and we are still not part of the policy-making processes. On the other hand, we bring in the urgency and the seriousness because it affects us most. It is our health and our future that is endangered. We also feel anxious and worried about our future, distressed about political inaction, but at the same time affected in the way of not being empowered with the necessary climate literacy and understanding of what climate change is and what solutions that are within our hands to do, because we still need more of integration of climate change in our education, in our school and university curricula. We still need to have and to be part of the design of what a health and a climate change country profile looks like, and what concrete actions we're doing that can be integrated within the policy design, but to also be part of the evaluation and the implementation committees at a country level as well as at the global level.
So we talked about am I heard well? Yeah. So we talked about the risks and what the youth can suffer as the consequences of it. But we're also aware that we need to present youth not only. Okay. But at the same time, we need to be aware that it's important to present youths not only potential and actual victims, but also as the agents of change. And so if we take the Wales framework on health and climate nexus as an example, how youth can be more effective agents of change advocating for climate action using frameworks such as this?
So I have a few examples that I can share of how I've seen youth meaningfully engaged, especially in the health and climate space. I started 6 years ago. I was working with the International Federation of Medical Students Association, the IFMC. It's an organization that represents over 1 million medical students in 132 countries. What was so inspiring and gave me the opportunity to be part of the COP space was that we were always given the opportunity to work hand in hand together with the World Health Organization and the Global Climate and Health Alliance. WHO, as you know, also had the opportunity to develop country profiles for health and climate change. And at the same time, they gave us the opportunity to work together with them. And back in 2015, we were able to integrate health as a context in the Paris Agreement. And this was a student-led initiative with the support of the WHO. So it really shows that when you empower young people and give them a meaningful space to deliver their inputs, their agency, their activism, their solutions, because as young people, we are a very unique and diverse constituency. We have our own inputs because we get to see the effects of climate change, especially on health, at the front line. We work with our communities in a very direct and grassroots contact, and then we are able to very clearly and very independently voice our needs and voice our solutions and the challenges that our communities face back to the policymakers without any constraints. And this is so important, especially when we are involved in the development of policy frameworks, to always have not just the demands and the voices of young people and the challenges that we see, but also the small scale and the large scale solutions that we are leading. There are many, I always say that as young people, we are not just youth, we are young experts, entrepreneurs, farmers, health workers in our diversity of expertise, and we are inviting the policymakers and the academia, the researchers, to work together with us as natural partners and really address and place health and climate justice at the center of climate action and climate policies across all the different levels.
Thank you very much for emphasizing our rallying call about the fact that youth are not just youth, but they're also young experts. Tracy, with all of that we have heard about Wales' approach and its success and its potential impacts on others to follow, what, from your point of view, is one thing that makes particularly the Wales approach the most successful, and that others who are also keen on implementing such frameworks can take from Wales to spur their own success stories?
Thanks, Vlad. We're being very sustainable with the use of just the one microphone now, aren't we? It's difficult to pick one. But what I would say, I'll pick one with a bullet point, if that's okay. The first is that the act was derived from a national conversation, and climate change was the biggest issue for young people in that conversation, which was 2014-15. So it's a piece of legislation, probably for the first time in Wales anyway, that could resonate with the population. My bullet point then, because I know you said one, is you need a SOFI. Without a commissioner, it's another piece of legislation. Without that narrative, that enabling, that drive, that advocacy, that custodian to hold government and public bodies to account, I don't think it would have been implemented now to the extent that it has. Now, we've got a long way to go, but it's about leadership, behavior change, mindset change, and realizing that not one organization owns the resources it has. The public, in our context, own the resources. So how do we share the assets in order to transform health and well-being?
Thank you very much for this powerful conclusion. And now I would like to see if there are some members in the public who might ask a few questions. We can accommodate a few if you have any. Yes, please.
Hi, Sophie. Well, panelists, thank you very much for this panel. It's been very enlightening. But I'm very impressed with what Wales is doing, and congratulations to this act. Most governments are usually very interested in finance and economics as their time in government, in power. And how did you, I guess we talk about this theory of behavioral change and modification. So how did you get them to pivot towards this well-being trajectory, one, and then how did you get the citizenry to come on board as well?
Yeah, really, really good question. I think that obviously the initial thinking around it came from the national conversation. So and looking in parallel at the SDGs and what was going on in the best of countries across the world. And so when we defined prosperity in a different way in law, that didn't change anything overnight because we still had all of the old mindsets. We might have had a law, but we had all the old mindsets who were trying to kind of still cram what they were going to do anyway into a new definition. And I suppose there's a bit there, coming back to what Tracy said, around an independent commissioner to call that out. So, for example, on the example that Tracy gave on the road issue, that was a very, very live issue. The argument was economy versus environment. I mean, there were other issues, obviously equality, health, and so on, but the main thing was economy versus environment. And at the time, the government were arguing, well, we've got to do this because, there's an economic impact of all this congestion if we don't do it. At which I then can come in and say, well, actually, that's not in line with the legal definition that you have signed up to. So if I'm totally honest, it's been a slow burner because I think it's one of those things where people can say things in conceptual terms and agree with things. Like you could say, which country is which leader of which country is going to come here and say they don't want to act in the interests of future generations. I doubt very many of them would actually come here and say that. If you then say, okay, so let's legislate to ensure that that's what you're going to do, it becomes a slightly different conversation, doesn't it? But I think you have to keep pushing that. And so where we had that definition of prosperity, kept pushing and pushing that. Really interestingly, on that issue of the road where the Act won the argument, if you like, and there was a clash between my office and environmental NGOs and the business sector and so on. I think once that decision was taken, the business sector started to see that there was this shift in policy happening in Wales, and they started to think, actually, we need to come on board with this. And actually, there are opportunities for us to use this Act to be talking about how do we reskill and create new jobs that are going to help us to deliver the green agenda that we need. What are the sorts of investments that we can see in renewables? How are we going to, our consumer demand is telling us that we need to, act on climate change and these sort of broader sustainability issues. So we may as well get along with the government agenda. And they also, I think, started realising the fact that the government had this long-term vision, which wasn't going to change from one electoral term to the next, which is actually really highly beneficial to the private sector as well. So although the private sector aren't covered by our legislation, increasingly they're knocking my door and saying, we like the framework of the Future Generations Act, how do we start to report on it? And just this week, this is big news for Wales because for the first time in 64 years, our Welsh football team are going to the World Cup. I know you'll all be very, very excited about that, but that's just one of the reasons why I'm excited about it, because the other reason is that our Football Association, not legally covered by the Future Generations Act, have voluntarily come and said, we want to use the Future Generations Act to become the most sustainable football association in the world, and we will reform our entire business model and operation around those 7 wellbeing goals, because that's a framework for the whole of Wales, and we want to be part of Team Wales, not just on the pitch, but as a kind of our contribution to the nation. So that's where I think it's this building a movement, some tough arguments, at first, with government, outside of government, and then people start seeing, actually, there's a sensible pathway here that we can all get on board with.
Sorry, if I can just build on what Sophie said, I think it's also about making it easier to see the wood for the trees. So we had an election in 2018, and we had the piece of legislation was in. So in Public Health Wales, we have an amazing team who are a WHO collaborating centre on investment for health and wellbeing. One of the reasons we got that was because of the Wellbeing and Future Generations Act. So the team pulled together a cross-government, cross-sector, 10 prevention interventions, prevention being a way of working in the Act, that yield the biggest return on investment. And ministers didn't want to see 35 pages. They wanted a two-sided infographic that talked about early years, it talked about active travel, it talked about alcohol, physical activity. Where was Wales? What was the evidence? What were the interventions that worked? And what was the return on that investment? And I can remember meeting with a housing minister, Rebecca Evans, at the time, with an infographic that wasn't quite finished. And I reluctantly gave it to her, and she held on to it for the whole meeting, because it started to allow them to look at where do we spend finite resources. So it's also about how we present information that brings economic modelling in, and that it's that short-term investment for long-term gain, which has to be the financing model of a piece of legislation that transcends governments.
Thank you very much for your question, and thank you very much for having this opportunity to round it up with such a fantastic, detailed example, a success story within a success story as well, like you mentioned, within Welsh Football Association. Dr. Kelly, you want to? Yeah. Yes, one last question, and then we will have to wrap up. Thank you.
Yes, good afternoon, all. I'm from the Bahamas, and the World Meteorological Organization has sectioned the world into 6 regions, and we are in Regional Association 4, which is North America, Central America, and the Caribbean. Now, while the Bahamas boast sun, sand, and sea, we are number 1, 2, and 3 all time from 1871 in the number of major hurricanes that would affect anywhere in that region. Now, what we have done previously was psychological first aid, on when these impacts have happened, how they affect the elderly, but never the youth. Because many times of late, when we start to interview some of the younger persons, they are so despondent and say, oh, the place is destroyed and they don't have. So really, if we're going to have the impacts of climate change and more severe hurricanes, we'll see how that will be affecting the youth of the country. And then Sophie's Wales thing, I was very, very impressed, And I studied at Reading University in England. And guess what? I also realized that the weather pattern there, you get blanket rainfall. But in the Bahamas, we have a convective rainfall where I can have rainfall right here and dry here. So while I was looking at your model, I was saying, well, maybe that might be fine for Wales, yeah? But we're going to have to do a concerted effort to use the principles that you have put in place, all right, to guide us into formulating something that will be specific or tailored for the Bahamas, because I don't think one pattern might fit all. Thank you.
Thank you, Doctor. Thank you. Dr. Kelly, if you want to have a quick follow-up on what was said.
I'm in total agreement because Mr. Basin is an expert in the area and has been working all of the hurricanes in the Bahamas. I remember working with him. And Dr. Hamilton would have been part of the response team for Dorian. And one of the areas that we spoke about was the mental fatigue that healthcare workers as well, having been impacted, and how we can provide the support for them. And now that it is 3 years post-Hurricane Dorian, when we went back to both Grand Bahama and Abaco, persons were still impacted emotionally and asking for psychological help. So we know that we need to build into our own program this long-term mental health component. And indeed, the Welsh Act, the Wellbeing Act, we will have to look at the various components because we are an archipelagic nation, which makes it quite challenging in terms of coming together. But I think the principles are really significant. We had a conversation with Dr. Roll, who said, If someone is talking to you about violence and crime and poverty, and you're talking about climate change, there's no connection. And so the Well-Being Act, it presents the basic concerns of the population that are impacted by climate change, and we need to take care of the basic needs. And I think we've kind of moved away in that way, and this is an opportunity to go back to the basics of the well-being of the population.
Thank you very much. And Omnia, if you want to chime in.
No, just one small thing I wanted to add, because you mentioned something very important, that in many occasions when we think about the health impact, especially on climate change, and we address the vulnerable populations, we tend to sometimes exclude the children and youth, not really understand how directly affects them and how disproportionate it is. And I think one important way to address this is youth-led research. So to have young experts in their universities and their schools do the research, because they are already very passionate around the issue, but they would also need your mentorship, your support, as well as your help when it comes to financially, or even the experience itself. I've participated in many social enterprises where we did, like even digital academies or a mentorship opportunity with young people, and help them do their own research with their own communities, because we would understand our needs and then how to communicate, especially the engagement of children and adolescents, who are such a powerful voice for climate action, and involving them in the design of policies is also very critical and very meaningful for them as well.
Thank you very much, Omnia, and a huge thank you to all of you for presenting us with such an inspiring and at the same time practical picture of what a health-based approach to climate change can achieve. Thank you very much for the time you dedicated to us. Huge thanks to all of you who came and listened to our wonderful speakers. And of course, huge thanks to the Office of the Future Generations Commissioner Wales for organizing this session and making sure that we are able to partake in such a wonderful practice. I wish you all a good day, and thank you very much for being with us.